With obstructive sleep apnea, the two main treatments are CPAP or what's called an oral device. And ultimately, we like both options. It depends on the patient. So CPAPs are usually recommended for patients who have more moderate to severe cases. And so that's when that airway is closing over 15 times per hour per night. We often recommend a CPAP because what a CPAP is going to do is it's going to blow air into that airway so that it physically cannot close, which means that you're breathing throughout the night, you're sleeping better. The downside of CPAPs, though, is that they are often uncomfortable. They can cause claustrophobia. The older machines were loud, and so you would trade snoring for just a loud machine. Those have gotten a lot better, and the masks have gotten a lot better. But there are still patients who just can't tolerate wearing that. So what we can do is we can make an oral device. What the oral device does is it's going to pull everything forward up out of that airway to help keeping it from closing. However, it still can close down, which is why for most patients we like the CPAP if they can tolerate it. If they can't, we want to help them with that oral device. The oral device tends to be more comfortable, which also means that patients tend to wear it all night long. So rather than a CPAP where you may wear it 2-3 hours a night and then get tired of it, you're going to wear that oral device all night long. So even if you're still having some events, you're having much less events than you were without your oral device, and you're wearing it all night long, which sort of in the long run kind of evens out. I also have a lot of patients who actually have both and will often use an oral device for travel. So instead of having to lug a CPAP around, they can just pop their oral device in their luggage and take that to travel. Whereas with a CPAP, they'll use that at home. They use that kind of most nights to help, but they do have an oral device as a good travel option.